All right, well, let's go ahead and get started because you guys are all here. So for starters, I'm Dr. Patti Haebe. I'm a naturopathic doctor, and I'm the medical advisor for Premom. Um, I have a focus on fertility and hormone optimization. I have a private practice, and I've been working with Premom though for the past year to help develop and launch this virtual consultation feature. I just think there's so many women out there with subfertility that just need a little extra help, and this is such a great resource. So we're really, really excited to be launching it, and I'm excited to talk with you guys more about it today because I just think it's an awesome tool to be able to connect people to uh, providers that can help them the best for whatever they need. um, so I first started using Premom years ago, actually, personally for tracking my cycle. I use it with all my clients use it just because I find it to be the best place to track everything, which you guys all know because you're already using it. I struggled with PCOS and irregular cycles for a long time. Even after getting off to hormonal contraception for years, my hormones were just kind of crazy. So was able to use this to kind of dial in and zoom in and get myself fixed up. So I have a son currently, and all through that. Let's see. Um, so in addition to my private practice and then working with Premom as their medical advisor, I also do provide virtual consultations via the Premom Pregnancy Advisor consultation application. So I'm familiar with being on both sides of the app. I've been on the user side, tracking my LH, my basal body temperature, my progesterone levels, all that stuff. And then I'm also on the provider side, helping people kind of dig in and figure out what's going on with their fertility. So a lot of people were wondering kind of what consultations are and kind of the purpose of them, the benefits users get, those general questions. So I'm going to kind of run through those a little bit at a time just to give you guys a little introduction to kind of what it looks like. So these consultations were created in order to connect users of Premom with fertility specialists. A lot of times we're kind of limited just by our OB or our PCP, and there's so many awesome instructors out there that we just really wanted to bridge that gap and help make these connections. So this is a collection not just of doctors, but of fertility awareness method instructors from Creighton, from Marquette, like all different types of natural family planning techniques. We have nurses, nurse practitioners, MDs, DOs, naturopathic doctors, so an integrative approach to care, as well as even some nutritionists and holistic practitioners. We may even be bringing on some like mental health pieces in the future as well. We're really just trying to provide a really well-rounded approach to fertility, and everybody's needs are so unique, and we're really trying to cater and connect people to that. So how consultations work is it kind of depends on your need. Whatever it is, we have a consultation available. So for very, very basic stuff, you have people that are just trying to learn baby making basics. A lot of you are probably veterans and you're really good about using BBT and your LH strips, but some people, it's a lot to learn. Are you taking your LH at the right time of the day? Is your basal body temperature being tracked appropriately? All those things. So sometimes we have like fertility awareness method instructors, for example, available for that. Then we also have it available for people who have troubleshooting. So my basal body temperature is spiking, but I'm not getting an LH peak. What's going on? Am I doing this right? Am I missing something? What's wrong? Am I timing intercourse appropriately? So those are kind of the differences we have. Let's see. Also, maybe people have been like tracking for a few months, still not pregnant, and they feel like they're missing something. I just kind of want to know if they're doing it right. So that's sort of what we're providing at the kind of that approach. And then it gets into more complex things. So, I'm having irregular cycles. I haven't conceived after a few months. I'm not thinking that I'm ovulating. Why am I not ovulating? My doctor won't work with me yet. I have PCOS. I've been trying for 6 months. What are my next steps? And when you get into these more complex cases, you could consider working with a doctor who's able to identify what your next steps need to be. Do you need lab testing? Do you need imaging? Is it nutritional and lifestyle changes that you need? What products could be helpful in helping you with that fertility? and just really helping to explain options that are available. And really, my goal is just for people to really learn to advocate for themselves, give you the tools and the education you need to get the answers that you need. Because I know not always every doctor is, willing to work with you the way you want to be worked with. So I always like to educate people, give you the knowledge, and then you're able to go and seek out the answers and solutions that you need next. So just options to provide that deeper insight. So we have that kind of broad spectrum, which is really cool. So what a consultation looks like is you access it through your phone. It can be a chat, it can be an online call, it can be a video. They're all secure and it's through the app. And we kind of look at what the client is looking to gain. So, maybe you want to know, are you timing intercourse correctly? Why are cycles shortening? Are you doing everything right? Do you just want to make sure and, here, do I just need to calm down and wait for this to happen, or am I doing something wrong? What are the next steps in investigation? So that's kind of the beginning of the consultation. And then depending on whether you're working with a fertility awareness method instructor or a doctor or a nurse, we'll dig in different ways, analyzing your cycle, using your data. From the provider side, we're able to see everything that you allow us access to. So we can see like all your LH strips, we can see any progesterone tests you've taken, any pregnancy tests, and we can use all that information. We can even do a screen share feature where we can walk through your data together, which is really, really cool, and say, this month was good, this month something was wonky, let's dig in. And then in these visits, we can use the rest of the time to talk about dietary and lifestyle changes and improvements in your charting or intercourse timing, or maybe you need to track cervical mucus a little bit differently, provide dietary and lifestyle recommendations, or even propose considerations for I'm a fertility awareness method instructor. It looks like you're doing everything right. We're missing something. Let's consider moving you to the next step, working with a nurse practitioner or a fertility, like reproductive endocrinologist or an MD, to see what's missing here, and kind of propose those considerations. And so, from there, recommending imaging, lab work, nutrients, just giving you the tools basically you need to go out and figure out what's going on with your fertility. So that's kind of what a consultation looks like. They're usually about 30 minutes long, is pretty much the norm. So it's a little longer than you'd maybe get with your typical doctor's visit, which is kind of nice. It gives you more time to ask questions. Our providers don't have to feel so rushed. It's just time for us to sit and connect and really dig in and figure out what's going on. Let's see. Somebody else was asking about the 9-cycle guarantee. So I'm not sure if you've all heard of that yet, but Premom, it's so cool, is offering this 9-cycle guarantee, which I think is awesome. So as long as you have done 6 cycles, you've had an LH spike, you've had your basal body temperature tracked, and you've been timing intercourse correctly in your fertile window, and you're still not pregnant after 6 cycles, Premom is actually providing a consultation with either a fertility awareness method instructor or a doctor, which is really cool, just to make sure that we're getting you where you need to be, we're troubleshooting, and we're getting you results. So somebody had asked if, I think somebody already was on like cycle 7 of the 9-month guarantee. The app is trained to flag you, and usually we reach out to you. Of course, technology, sometimes glitches can happen, so feel free to contact customer service if that was you, and they'll double check and make sure you've met all the qualifications and then get you scheduled for that as needed. What else? Perfect. Let's see. Somebody else asked, so yeah, this is a good question. So kind of how is this different from a normal doctor's visit? One of the main driving reasons that we put this together is because according to the American College of Obstetrics and Gynecology, doctors aren't really going to start digging into your fertility if you're under the age of 35 after you've been trying to conceive for 12 months, and if you're over the age of 35 for 6 months. And I don't know about you, but when things aren't going right after 5 months, I start to get frustrated myself. I want to dig in, I want to find answers, and I want to get to that solution. So a cool thing about this is we've created this to provide education and resources to people whose doctors are saying, I'm not really willing to jump in yet. And in their defense, they don't have to. Our industry medical standard is that you don't have to intervene or investigate until 12 months or 6 months if you're over the age of 35. However, medicine is just not one size fits all, and it tends to be very reactive instead of proactive. So we're really kind of flipping the script on fertility and creating a proactive approach and resource for people, to talk to providers and then start investigating early, giving you the tools to get your own thyroid tested, figure out what you're looking for. How is your ovarian age looking? Stuff like that. Are your nutrients optimized? Are you using the app appropriately? Are you using LH strips correctly? What's that looking like? Are you timing intercourse appropriately? Really kind of digging into that stuff, there's just so much we can do. And as doctors in a traditional primary care setting, there's just not a lot of time to sit down and look through this data. And so this is why we really wanted to create this resource. So let's see, what other questions? I think that's about most of them. Someone was asking about the cost. So the cost varies. So depending whether you want to work with a fertility awareness method instructor, you want to work with a naturopathic doctor, you want to work with an MD, you want to work with a reproductive endocrinologist, pricing varies between $40 to $200. So it's kind of whatever you're looking for and what specialty you're looking for. We're not accepting insurance at this time. But it's kind of cool because you just get to pick who you want to work with. We're building a huge database of these providers. You can read through, look at their bios, see what they specialize in, look how they approach fertility. You may want someone super conventional and by the books. You may want somebody who maybe knows a bit about herbs and nutrients. You might want somebody who really focuses on nutrition and dietary changes. So you can look through and find somebody that's a really good fit for you, which is kind of cool because it's hard to find somebody, and especially when it comes to fertility, you really need somebody who's a good fit for you. Will the consultants be able to help older moms trying to conceive over 45? Absolutely. Anybody can be seen in this process. And I know a lot of times IVF clinics will close their doors when women turn 43 or 45. And that's not our approach here. Our approach is anybody is welcome and we'll do whatever we can do to support you. I've worked with a couple people over the age of 43 and above 45. And there's still hope. There's lots we can do to still support those eggs, optimize your body. So yes, over 45, more than welcome there. But so we're at about 15 minutes now, and I think I've covered most of the questions that we had submitted. If you guys have any else, feel free to comment them. We'll also go ahead and do a survey for our next Q&A, and we'll get any extra questions answered there. So thanks everybody for tuning in. I hope you guys learned a little bit about this consultation feature. You can access it through your Premom app. Let me pull up my app so I don't misspeak. We all have Premom on our phones, right? So if you hit the More tab at the bottom of your page, there's an option and you can hit a button that says Schedule Consultation. It's a big pink square. You can either add your own OB or PCP doctor onto Premom, which is really cool. So you can actually meet with your own OB/GYN through Premom, which is super neat. You can connect. If you don't want to work with your OB, you can work with somebody else. So other providers are listed, and it's NFP certified doctors, OB/GYN doctors, NFP, excuse me, dry throat, NFP certified nurses and health professionals, and then we have kind of an other category for other people. And you can just browse around these categories and find somebody that's a good fit for you. Okay, that's it. Thank you all for your time this morning or this afternoon, depending on where you are coastally. But hope you guys all have a great weekend and you learned a lot. Bye. We'll see you on the app.